we tend to know families or persons that are suffering from it. And that is why we feel the need to look at this topic. Even though the time might not be enough, we will just make do with the limited time we have in looking at diabetes.
Recording in progress.
The question we're going to ask ourselves now is, just give me a minute. Let me move to the next slide. Yeah, we are having a little bit of a network challenge here. But if you can see my screen, let's start off by what diabetes really means. What is diabetes? Now, for our lay people, those who probably may not be too conversant with deep-seated academic definition, what they know as diabetes is when somebody is always passing urine excessively, and when this urine tends to that when tested or tasted, it has a little bit of sugar in it. That is the common knowledge a lot of people have. But for we in the medical or scientific world, we see diabetes as a chronic metabolic disease. And this particular disease is one that needs to be looked into holistically because it is among the leading causes of death worldwide. As a matter of fact, it is among the 5 leading causes of death globally, diabetes. Now, if you look at the WHO prevalence, in 2019, WHO estimated that 463 million people were having the disease. 463 million people were having the disease. It is equally estimated by WHO that the figure will rise. And they are estimating that by 2030, we should be having close to 600 million people globally that will be suffering or having diabetes. And by 2045, WHO further estimates that the number will rise up to 700 million and above by 2045. So what it means in essence is that we're looking at a condition that is not coming down. More and more people we know, and the ones we do not know, are having this disease on a daily basis because the estimates before us are not coming down. They are soaring high up. As we speak, even in 2024, it is estimated that the number has really gotten to 500 million people globally. Now, if we look at these estimates and we come back to our country here in Nigeria, the survey that was done in 2021 with the total adult population of 96,812,400, it showed clearly that over 3 million, close to 4 million Nigerians, adults, are having disease. So if we zoom into our own country, we have close to 4 million people that are having diabetes. So we're looking at adult population here. It is quite frightening that this particular figure, going by WHO estimates, for years to come, it will continue to rise. Now, the reason why this figure will continue to rise is because a lot of people are not knowledgeable or do not care or do not bother to want to know the disease until they find themselves suffering from it. So there's strong need, and that is why I truly appreciate this platform Superlife is giving to us, not just as members. Even we have non-members who are connecting almost on a weekly basis in order to learn. I truly appreciate this platform that we're learning a thing or two. So today's lecture is really going to help us because we will learn one or two things about this disease. Now we know we have close to 4 million Nigerians. And this number cuts across different families. Some of you here, you know one or two persons in your family that is having this challenge. Now, one thing we know about this disease, just like our local people will define it, is excretion of excessive urine. Those who have this disease tend to pass constant urine. In the medical terms, we refer to it as polyuria, where somebody is always passing urine. As we move on into this lecture, we're going to see reasons why they pass this urine. Now, for us to understand diabetes better, I think there will be need for us to divide it into two classes. Diabetes, because a lot of people have this misconception about diabetes. Most times, these misconceptions are usually one-sided, and it does not help us because we do not have the basic knowledge. So this lecture will help us, give us the basic knowledge about diabetes. So we'll be dividing diabetes into two classes. The first class is diabetes insipidus, and the second one is diabetes mellitus. Please, I want to repeat myself again. We'll be dividing diabetes into two classes for proper understanding. The first class is diabetes insipidus, and the second class is diabetes mellitus. Now, the question is, what is diabetes insipidus? Let's start with that particular one. Now, this particular diabetes, yes, it looks similar with diabetes mellitus, but they are different. How are they similar? What makes them similar is that patients with diabetes insipidus usually have polyuria. What is polyuria? Excessive excretion of urine. Excessive excretion of urine, where the patient is passing urine. Now, is this particular diabetes related to insulin? No. Please, let's take note of that. Is this particular diabetes related to insulin malfunctioning or inability of the pancreas, the islets of Langerhans in the pancreas to produce insulin? No. How is diabetes insipidus different from diabetes mellitus? This particular one is as a result of deficiency in what we refer to as ADH. ADH is antidiuretic hormone, and this one is usually found in the kidneys. It is a hormone that helps blood vessels constrict and helps the kidney control the amount of water and salt in the body. That is the function of this particular hormone, ADH. And once there's a deficiency in this hormone, the person to pass lots of urine. So this one has nothing whatsoever to do with insulin. It is a condition that affects. Please, I want to repeat myself again. Diabetes is a condition that affects the kidneys and has nothing whatsoever to do with insulin. Diabetes insipidus. Now, the reason why it is even having diabetes as part of its name, since it has nothing to do with insulin, because some people will want to ask that question. Why is insipidus having diabetes if it has nothing to do with insulin? The reason why it has diabetes as part of its name is simply because of the symptoms of increased urine production. which is similar with diabetes mellitus. Diabetes mellitus too. The patients with this condition equally pass excess urine. So because they share the same symptoms together, that is why we have that name diabetes attached to insipidus. Please, I want to repeat myself. Diabetes insipidus has nothing to do with it. Rather, it's as a result of the deficiency in a particular hormone called ADH. Yes, antidiuretic hormone. Now, though this particular condition is not too common in Nigeria, I know some of you will be so excited, but that does not mean we do not have people who are suffering from it. And the good news is that this condition, our medical doctors are really doing a yeoman's job for us. We really need to give them all the commendations. Yes, we need to give them all the commendations. Why? Because they can correct this condition by the enhancement of the ADH in the kidneys. Once the ADH is enhanced, the condition can be corrected. Now, let's look at the next one, which is diabetes mellitus. Diabetes mellitus. We've just finished diabetes insipidus. Now, one way you can identify diabetes mellitus is that just like we saw in diabetes insipidus, there's polyuria, that's increased urine production. But in the case of diabetes mellitus, there's something that is added, hyperglycemia. That means, what is hyperglycemia? It is a condition in which the level of glucose in the blood is higher than normal. That is why patients with diabetes mellitus, we often say they have high blood sugar. High blood sugar, where the level of glucose in their blood is higher than normal. Now, what can cause diabetes mellitus? We're going to look at it in details, but there are two well-known causes. One is resistance of the body to the action of insulin, and the second one is insufficient insulin production from the islets of Langerhans in the pancreas. So what do we mean by resistance of the body to the action of insulin? And what do we mean by insufficient insulin production from the islets of Langerhans in the pancreas? That will take us to the classification of diabetes mellitus. I'll do justice to those two questions while looking at the classification of diabetes mellitus. But before I go into the classification, there will be need for us to remind ourselves, now that we are talking about or referring to insulin, because if you look at the earlier slide, I said the causes could be resistance of the body to the action of insulin or insufficient insulin production from the islets of Langerhans in the pancreas. Now, the question we will ask ourselves, the medical personnel in our midst and those who are conversant with science know what insulin is or the functions of insulin. But to those who are not knowledgeable, I want to use this platform to let you know that one of the functions of insulin in our body is to allow glucose to enter cells to be used as energy. One of their functions is to allow glucose to enter your body cells. When we get to the issue of a Superlife product, there will be need for all of us to remind ourselves on this particular point I've just mentioned. The allowance of glucose to enter cells, because by the time we get to a Superlife product, I'll be reiterating this fact. Then the second is to maintain or regulate the amount of glucose found in the bloodstream. And what do? They make sure it remains within normal levels. That's the function, the key functions of our insulin. Now, we are looking at diabetes mellitus. This one is very, very common globally. and is very, very common in Nigeria. But there are two types again. There are two types of diabetes mellitus. Now, what are the two types of diabetes mellitus? The first one is the one we refer to as insulin-dependent diabetes mellitus. We refer to it as type 1 diabetes. I'm sure a lot of you may have heard type 1 diabetes, diabetes type 2, diabetes type 1. So this platform will offer us that rare opportunity of knowing the differences. So what is type 1? Insulin-dependent diabetes mellitus. Now, going by its name, it means patients who are sufferers of type 1 diabetes are totally dependent on insulin. Why? The reason why they are dependent on insulin is because this particular disease is an autoimmune disease. What do I mean by autoimmune? It is autoimmune in the sense that the cells that should regenerate your insulin are often being attacked. They are often being attacked. And because they are attacked, it becomes extremely difficult for insulin to be regenerated. Because they are often attacked, insulin becomes extremely difficult to be regenerated. In immunology, for those in the sciences, there's a course called immunology. One thing, each time autoimmunity is mentioned, we often say that it is the negative side to your immunity, where your immune response attacks its own cell. Yes, we see it. It is often referred to as autoimmunity, where your own body cell is attacking itself. So in this case, cells that are supposed to regenerate insulin are attacked. And because they are attacked, the person finds it extremely difficult to produce insulin. And because the patient cannot produce insulin, the patient is completely dependent on exogenous insulin to sustain his or her life. That is why you find the patient totally dependent on insulin. Now, we find this particular type 1, that's insulin-dependent diabetes mellitus, being more prevalent among children and young adults, especially in developing countries globally. And that is why if you go to most journals, go to a lot of books, they refer to it as juvenile diabetes. Juvenile diabetes, because it is prevalent amongst children and young adults, especially in developing countries globally. So please, let's take note. Insulin-dependent diabetes mellitus type 1 is an autoimmune disorder that attacks the cells that are supposed to regenerate insulin. And because of that, the patient is totally dependent on insulin to sustain his or her life. The second type of diabetes mellitus is the one we call type 2. This particular one, the medical personnel refer to it as non-insulin dependent diabetes mellitus. Non-insulin dependent diabetes mellitus. This is the one we refer to as type 2. This particular one is very, very common. It outnumbers the other types. Please, let's refresh our memory. What are the other types? We've just talked about type 1. Don't forget, we talked about diabetes insipidus earlier. So please take note. Let's not forget. So type 2 outnumbers all other types of diabetes. Now, what is type 2? Now, type 2 is the one we often talk about each time Hello, can you all hear me? Hello, can you hear me?
Yes, we can hear you.
Thank you very much.
Continue, sir.
We can hear you, sir. Carry on, sir.
Yeah, thank you very much.
Yes, we can hear you, sir.
Yeah. Type 2 accounts for 90% of the cases of diabetes we have globally. That is why I say it is more prevalent, especially in developing countries. Diabetes mellitus. Even in developed countries, you will find them there. But you know what is going on in developing countries. We are beginning to have more of the numbers now. Now, in order for us to understand diabetes mellitus type 2, there will be need for us to go back to our pancreas. Our pancreas. Now, if we look at our pancreas, permit me, if I'm allowed to go back, I want to show all of you something. Let's look at this diagram closely. This is how our pancreas looks like in the body. Now, I've decided to zoom in into a structure called the islets, the islet of Langerhans. Now, they are the ones that produce, the cells there produce insulin. Are you getting it? They produce insulin. Now, once this is affected, once these cells are affected in any form, and the production of insulin is hampered, you now find out that the ability to normalize the glucose level within the body becomes hampered as well. And because that is hampered, you now find excess glucose going into the blood. This particular type of diabetes, we have seen it. The medical doctors are the medical personnel are quite aware. We've seen it amongst older age people. Some of the factors that militate are responsible for some of for this condition, we'll be discussing it later. But one thing we must understand is that this particular condition is still favorably disposed to insulin use, and as well it can be corrected with diet. That is why most times in some cases, when a patient gets to the hospital and they do a blood sugar test, and the doctor looks at the level and feels that this particular one might not need insulin. It's just the correction of the patient's diet. While in some cases, you find the patient being given some dose of insulin, and at some point, it is reduced to a point where the patient is kept on diet. So this particular one is totally different from type 1, where the patient is totally and completely dependent on insulin use. So these are some of the basic differences between type 1 from type 2. Now, there will be need for us to discuss causes of diabetes. What are the predisposing causes for diabetes? Number one, heredity. Number one is heredity. It is believed that certain people or certain patients get this disease because they inherited it. Though research is still ongoing with respect to finding how this can happen. We have gotten some breakthrough, especially with type 1. Scientists have discovered that there's a particular gene called the HLA-DR3 gene or the HLA-DR4 gene that is linked to immune disease that is very common with patients with diabetes type 1. Don't forget, I told you guys earlier that diabetes type 1 is an autoimmune disease where cells that are supposed to regenerate the insulin are prevented, they are destroyed. so making the patient totally dependent. So research have seen genes that are responsible for this condition, which means any child that comes out from a couple and is having this particular kind of gene, such a child is prone to diabetes type 1. Researches are still ongoing in discovering how diabetes type 2 can be inherited. The next one is overweight. Overweight, causes of diabetes. The second one is overweight. According to WHO, their 2022 report, between 60 to 90% of diabetics are overweight. And the reason being that their intake of carbohydrates and high-calorie foods is what is responsible for their weight. Why? Because there is no striking balance between the intake of food and the digestion as well as utilization of the food, leading to them gaining weight. So once your intake of carbohydrate and high-calorie foods are not controlled and they are not balanced, especially when you're taking them at the wrong time, like some people who eat very late into the night, they can just buy anything and take it. You're only predisposing yourself to a condition like this. Now, what does this do? This high-calorie food has a way of overworking our livers, our kidneys, and our pancreas. And once the liver, kidney, or pancreas breaks down, then that particular person is in trouble. So please, there is strong need for us to check our weight. A lot of Nigerians find it extremely difficult to go to a pharmacist, to go to a health center, even a primary healthcare center, just to check their weight, whether they are gaining weight. So there is strong need for us to be checking our weight constantly. The next one is lifestyle. It is so pathetic. It is so pathetic that today we see how parents do so many things that predispose not just themselves, but even their children to dangers of diabetes. A good example is in some of the parties we throw here in the West. You go to some of these parties, you find parents giving their children alcoholic drinks in cans. You find these children drinking alcohol side by side with their parents. Some parents will tell you they are giving their children the elite lifestyle by buying them ice creams constantly, biscuits non-stop, chocolates non-stop, and so many other refined foods in the name of living the good life, what they call the civilized way of living. But unknown to them, these lifestyles is inviting diabetes to become their next door neighbor, if not a room member. So please, as parents, let's watch the way we give our children soft drinks. Let's watch the way we give our children ice creams, biscuits, chocolates. And most times when we go to parties, they should not share in the alcoholic beverages we take. Don't give them alcohol. You are destroying their lives. Some men eat a lot of red meat. I see it a lot in Western Nigeria. Some eat a lot and drink wine in the name of enjoying life. No wonder in times past, diabetes was seen as the wealthy disease, the rich man's disease. But today, it's not only the rich that are having diabetes, even the poor, because of their carelessness, they too are having diabetes. Another condition that can lead to diabetes is wrong medication. wrong medication. A lot of people go on self-medication. And the reason why they go on self-medication, they tell you, is because the pharmaceutical drugs are expensive. And unknown to them, that by playing that kind of game, they expose themselves to dangers. Why? Because when they go get these cheap drugs, it costs a lot. And the dangers they get is it affects their livers, it affects their kidneys, it affects the pancreas. And most of them take these wrong medications for a long time. And the more they do this, they find themselves landing in trouble. At the end of the day, they run back to the pharmacist, they run back to the medical doctors. So please, these are some of the causes of today's diabetes that we see globally. Now, let's look at some of the effects of diabetes. It is pathetic that even at lectures like this, where we tell people some of the predisposing causes of diabetes, you still find people nonchalant, still going about doing those things that predisposes them. Maybe by the time we look at the effects of diabetes and what it can cause, those who are listening today will take precautionary measures to ensure they do not predispose themselves to diabetes, especially diabetes mellitus type 2, the one that is prevalent in our country, Nigeria. What are the effects of diabetes? Number one, those with diabetes stand a chance or the risk of stroke. The risk of stroke. The risk of having stroke is 4 times higher with people suffering from diabetes than those without diabetes. And what does it do? Diabetes prevents your body from processing food properly. And when your body is not processing food properly, then you can't make insulin. And when insulin is not there, you begin to find glucose entering your blood, building up in your blood. And over time, once there's a high glucose level within your blood, it damages your blood vessels. And once your blood vessels are damaged, it increases the chance of stroke. The second one is extreme thirst. Those with diabetes, you find them always looking for water to drink. We refer to it as polydipsia. Now, we equally use extreme thirst to recognize the first early signs of diabetes. The first early signs or symptoms of diabetes, extreme thirst, where somebody is always needing water to drink. Now, why does this happen? When the kidneys cannot keep up with the extra sugar that goes into the urine, then what do you expect? There will be dehydration. And once there is dehydration, you find the patient always looking for water to make up. So one of the effects is extreme thirst. The third one is sweet smelling breath. Yes, sweet smelling breath. Some of you will be wondering, do they have sweet smelling breath? Yes. That is as a result of high level of ketones. Yes, it is a chemical that the liver produces when it breaks down fat. So you find them producing sweet smelling breath. The next one is they stand a chance or the risk of having heart diseases. Why? Because there's high blood pressure, which damages the blood vessels and put a strain on the heart, increasing their risk to cardiovascular diseases. So one of the effects is risk to heart disease. Another thing that can happen to diabetes is those with diabetes is loss of consciousness. Loss of consciousness. Now, there's what we refer to as ketoacidosis. Once there's excess of blood acid, excess blood acid, from ketones. Once it is high, it leads to blood acid, what we refer to, or the medical personnel refer to as ketoacidosis. And once this thing is present in the body, it can lead to loss of consciousness. It can lead to loss of consciousness. The next one is visual disturbances. Those with diabetes, especially diabetes mellitus type 2, will often advise them to seek medical advice and medical care immediately. Why? Because if it is not taken care of, it can lead to damaged blood vessels in the eyes, which can impair the eye. And sometimes you'll find patients who have diabetes type 2s having floaters around their eyes. These are spots that impair visions, and it can lead to blindness. Another thing diabetes mellitus or diabetes can cause is cataracts and glaucoma. We see this a lot with diabetics, and there's strong need for them to consult with the medical personnel to see how this condition can be ameliorated. Please always check your sugar levels. It is often advised that you check your sugar level so that it does not lead to a point where there's a damage to your retina, the retinal blood vessels. And once that happens, cataracts and glaucoma can set in. Then those who are diabetics stand a chance of risks of infections. Diabetes can raise your risk to bacterial, fungal, and yeast infection. So people with diabetes are often advised to do constant check to avoid this dangerous condition. Those with diabetes. Hello, can you hear me? Are you still with me?
Yes, sir. We can hear you, sir.
It's okay. Thank you very much.
We are still with you, sir. Go on, sir. Carry on, sir.
It's okay. And those with diabetes,
Doc always request we should go to the chat room to say yes or no.
Those with diabetes, you see them often complaining of being fatigued and lacking energy. And there are reasons for this. Enough insulin to find out that the person is not having enough to use for energy. Those with diabetes mellitus equally stand the risk of having high blood pressure. High blood pressure. Yes. Why? Because the heart itself is already under pressure. The veins, the arteries are already in a condition that are no longer favorable to the heart, allowing the pressure of the valves to pump up, leading to serious health conditions which the medical personnel refer to as high blood pressure. Already we can see how the islet of Langerhans within the pancreas helps in the production of insulin. So once a patient is having diabetes, especially diabetes mellitus type 2, it can lead to pancreas malfunction. Pancreas malfunction. Why? Because one of the key components within the pancreas, the islet of Langerhans, has become malfunction. So that in a nutshell can overall affect the activity of the pancreas. So people with diabetes should really need to be very careful. There's urgency. There's need for serious urgency once you notice your sugar level is going up. There's need for constant tests. Please, as Nigerians, make it a duty to constantly check your blood sugar level. You can start with the urine sugar. Even if you don't want to go immediately to do a blood sugar test, you can start with the urine sugar. The medical lab scientists have a way of doing a dipstick, using the dipstick method, and they can just easily detect that something is wrong and advise you to go for a further test, which is a blood sugar. It can be a random blood sugar or a fasting blood sugar. The doctors will advise you on the particular one to carry out. Another challenge people with diabetes have is what we call gastroparesis. What is gastroparesis? Poor blood sugar management, which are caused as a result of delayed in emptying of food from the stomach. Yes, even your stomach too will suffer the punishment once you become diabetic. Why? Because it becomes bloated. You tend to have heartburns and you tend to have nausea, the feeling of vomiting. So all of these things can set in patients with diabetes, not to forget excessive urination. You find them always getting up in the night to go and urinate. Always getting up in the night to go and urinate. Some of them you find protein in their urine, and some can go as far as having ulcer, leg ulcer. So these are some of the challenges you'll find once somebody has diabetes. So with all that I have mentioned, they all look very scary. Indeed, they are scary. And that is really the need why we must ensure we don't come down with this condition. For all of you that are listening to me today, please, if you have not done a routine check, blood sugar check, please kindly take my advice. There's need for us to do either a random blood sugar test or a fasting blood sugar test. The medical lab scientists, our doctors will advise you on the best approach for you to take. There is need for us to check our sugar level. So if you're here listening to me today and the last time you did it, you cannot remember, please make sure as the week unfolds, run to a lab and get your blood sugar test done. Now, why are we having our figures in diabetes soaring high? Why is it that during the days of our forefathers, the figures were low? And that is because our forefathers had herbal therapies that they were using. We have left the herbal world. We are busy enjoying life, drinking wine, eating red meat, taking alcohols, going to parties, eating junk food. We've left the herbal world to our old parents. And that is why today we are the ones suffering it and not them. What were they doing that we are not doing today? Now, our forefathers knew clearly that the herbs they have for diabetes can help repair the pancreas. You will ask me, how did they know? Of course, they had knowledge. For some of us that have had close ties with our herbal practitioners in the villages, you'll be so shocked by the amount of knowledge they have with respect to plants. Sometimes we feel because we are educated, we've gone to the university, we know better than them. Sorry, I'm here to surprise a lot of us. Our folks in the villages know more than we know with respect to plants. They know very well that plants, especially the ones related to diabetes, can repair the pancreas. They know plants that can strengthen the kidneys. They know plants that can help in preventing the sugar or glucose escaping into the urine. And they do their best to see how they take these plants often. And that is why you find them having natural balance till old age. Most of them going beyond 100. Today, life expectancy in Nigeria is less than 50. Is it our forefathers we have to blame? No, we have to blame ourselves. No wonder the elders will tell us that we, the young people of today, we don't listen to them. And that is why when an average Nigerian died today and he is buried, if you go to his grave years later, the herbs that would have solved his health problem you'll find that particular herb growing on top of his grave. Please, I'm not saying this to insult us, but it's to draw awareness. Now, let me let you know some of the materials our forefathers were using for diabetes. One, they were using the stem back of cashew. They know how to use the green pawpaw leaves very well. They know how to use bitter leaf very well. They know how to use scent leaf very well. They know how to use garlic and ginger. They know how to use what we refer to as Xylopia ethiopica, the one the Yorubas call erunje and the Igbos call uda. They know how to use what in the medical world we refer to as Capsicum frutensis. The common name is the African red pepper. The Yorubas refer to it as ataye, while the Igbos call it ose, olibo. Now, they know how to use all of those products. And there's a way they blend it. I'm not going into that today because that is not our discourse. But there's a reason why I keep on bringing reasons why, as Africans, we must not throw away the knowledge of our forefathers. They never knew stem cells, yet they knew how to get cells from herbs. Cells that will rejuvenate the pancreas, cells that will make the islets of Langerhans work, cells that will stimulate the kidneys. And today, for we who are in the cities, the good news is this. If you are afraid to go back to our olden days herbs, you have the Superlife products. The Superlife products have taken from where our forefathers stopped. They've taken that knowledge further, they've taken technology further, and they've been able to harness all the cells, the valuable plant stem cells that will help rejuvenate the islets of Langerhans within the pancreas, thereby helping regulate excess sugar or glucose so that they don't become excess to a point where they begin to enter the blood. So with the Superlife product, stem cell technology of the Superlife, you find out that the islets of Langerhans keeps on working, keeps on being rejuvenated. Why? Because this technology goes directly into the cells of the islets of Langerhans. Don't forget, it is a cell, cell to cell. And because of this, the overall performance of the pancreas becomes extremely good. And once the overall performance of the pancreas becomes extremely good, the entire well-being of the patient becomes good. Now, for those who have diabetes, for those who are having insulin-dependent diabetes, the advice I will give in this lecture is because the patient is totally dependent on insulin, medically, we do not advise such a patient to stop. What the medical practitioners, especially those who are using Superlife products, do is that they give the Superlife product side by side the insulin to a point where the insulin at some point is reduced while the Superlife product is increased. But at no time do we stop the insulin for those who are insulin dependent. Yes, that is diabetes type 1. But for diabetes type 2, the STC30 as well as the SIC are products that we give often to patients with diabetes type 2, which is the prevalent diabetes in Nigeria and the prevalent diabetes globally. How do we give STC30 and SIC? The way we do it is we give both. The patient will have to be on both daily for 12 weeks They'll have to be on it daily. That means the patient will have to be taking STC30 daily and SIC daily for 12 weeks. But in the course of our meeting with patients, we have equally observed that some patients are, especially diabetic patients, there are some of them that are not too tolerable with STC30. For these ones that are not too tolerable, that their body may not tolerate STC30, the recommended Superlife products that are given to this kind of patients is SNC, that's our Superlife Neuron Care, with the SIC, that's the Superlife Immune Care. And the two will be given daily for 12 weeks. So the beauty is that our products, the Superlife products, starts from where our herbal products in the villages stops. We've taken the technology further. And because they are all plant-based stem cell products, it diffuses into our cells and it is able to regenerate, reprocreate cells that are dead. So even in autoimmune condition that we discussed earlier, you find out that our products are doing extremely well. I want to give kudos to all the medical doctors, the pharmacists, and all the researchers that are spending quality times doing more and more research into stem cells that are producing the beautiful products we are having in Superlife today. That is not only helping the lives of people, but it's equally turning the world around. I want to say a big thank you to our medical doctors once again, a big thank you to our pharmacists, and a big thank you to the Superlife world generally. Once again, I want to thank all of you who have joined this lecture today. I had to make it within the hour given or allocated to me. This topic is a major one and can take a whole day, but I had to do my best to summarize. Once again, I want to say a big thank you to all of you. Thank you and God bless you.
Wow. God bless
Thank you, and God
too.
bless you, sir.
Please, can you go to the chat room? Just 3 fire emoji, please, to appreciate.
Thank you very much, Doctor. God bless you,
Please,
sir.
go to the chat room, please. Sorry, if you are thanking him, just go to the chat room, give him 3 fire emoji. The energy is there. The message is clear. Honestly, the language is so simple. Doc, God bless you once more. And by nailing it with the stem cell, plant-based, is a new and that's why in our book, he said, inspired by nature, realized by science. Stem cell, plant-based stem cell, is inspired by nature, is natural, realized by science. And that's how he concluded his meeting. I want to bless Mr. Oswald with his 3 fire emoji to Dr. Egbe. I thank you, Brendan Ekwem, with your fire emoji. A legend, Isaac Obi. Oh, God bless you, with fire emoji to Dr. Egbe. Then Edward Chibuzo, Ezekiel. Thank you. Please, I want more and more. God is enough. God bless you. We have to take time to honor Odozi Esther. God bless you. Thank you for appreciating Dr. Rove Egbe with this wonderful delivery.
Yeah, what?
You could see that this lecture, honestly, this workshop needed even our family members to sit together in a table, listening to it together as a family, not one person. Please, I want to encourage us. The subsequent workshop, which should be coming now, is on every Friday, once a week. Gather your family members, even closed door neighbors, possibly if they don't have their own Zoom, something. Sit together and receive it. You never can tell We use this wonderful knowledge to do a whole lot. Knowledge
Abbas.
is power.
That's Zoom.
So, thank you very much once again, Doctor. And I don't know, I think because we call it workshop, before we come up with our questions, please, you can go to the chat room, drop your question. It will help us to manage our time, please. Just go to the chat room, drop your questions. Even as I'm going to allow, I think I cited Dr. Chuks Egbe, you know, where Dr. Chuks Egbe is on the roof, is in the room. God bless you, you're welcome, sir. So he nailed it where the plant-based stem cell. And Dr. Chuks, a WHO doc and analyst, God used him to dive into our stem cell product with other consultants. And they came up with a very well robust manual, first of its kind. Even today, early this morning, when I shared something to the corporate, they saw it. In short, they were still giving kudos to Nigeria, to this good work. So, Doc, God bless you for championing this. You just volunteered yourself, volunteering. Nobody paid you when you started years back to dive into Superlife product. And today we have a very wonderful manual. I want to please give you a platform so that you still some things on how we can navigate in the manual. And I know you are already started talking about the volume 2, but we have to exhaust this volume 1 first. We have to know how to navigate in this volume 1. So please go to the chat room and drop your questions, please. While Dr. Chus will give us some highlights. Doc, are you there? Dr. Chus?
Yes, Dr. King, thank you very much.
You're welcome, sir.
Now, the network is not too palatable here.
I noticed it, yeah, I noticed it. Welcome. God, just go ahead. We're with you. Oh, you muted. Can you unmute yourself, sir?
Can you hear me now?
Yes, yes, we can hear you.
So, Dr. Rolfs, thank you for the lecture. It was a wonderful one. Just a contribution to that. There are some women that come down with diabetes during pregnancy that we call gestational diabetes. So that diabetes often resolves or goes away after parturition, after giving birth. But from research, we found out that familial diabetes, that has to do with bloodline. Familial diabetes sometimes comes up postpartum. That is after delivery that we expect gestational diabetes to disappear. It will come back again after delivery. Most of them are linked to genetic factors by maternal transmission. So we found out that there's increased maternal transmission in diabetes, which often resurface postpartum after delivery. So that is why we can give Superlife products to pregnant women from that are in second trimester, especially from 6 months. We can give them ST30 or any of the products. The only one we may not give them is the LCC Plus, except on very crucial or very chronic infect or sickness or disease. You can give them. So then as I said, that manual is what we need to study it as textbook. If you must have to study it as textbook. And by now, someone that bought that manual since the day of the launching supposed to be able to at least read half of it, page to page, page to page. So it is when you study this as textbook from page to page, you're able to make some meaning or make meaning out of it. Because like what Dr. Rosa have just said, the diabetes is there. In the manual is clear on the alphabet D. You also have hyperglycemia, which is increased blood sugar level, is there as alphabet H. You also have hypoglycemia.
Hello. Sorry. Doc, can you unmute yourself? Sorry.
Why is he muting? I'm not the person muting it too.
Please, co-host.
Okay, so as I said, you have to study that manual from page to page. When you study from page to page, you're able to get the meaning of most of the things that are there. I was saying also that diabetes, like which Dr. Rose has just dealt with, is there as alphabet D. So, but you also have high blood sugar level, hyperglycemia, is there as alphabet H. Then low blood sugar level, hypoglycemia, is also there as alphabet H. So if you don't study them or read that manual page by page, you may not be able to know that all these things are there. Then more importantly, we should always not forget to send our people that have been down with diabetes for the past 1 year, 2 years. We should always recommend them to do a test that we call glycated hemoglobin. That's hemoglobin A1C. Can we hear me?
Yes.
Everybody, can you hear me? I want everybody to take this one note. Can everybody hear me?
Doctor, we are with you. Carry on, carry on.
So,
Doctor, we are hearing you, sir. Go on, sir.
Apart from the regular fasting blood sugar or the regular random blood sugar or the regular oral glucose tolerance test, OGTT, or the regular 2 hours postprandial, there is a test called glycated hemoglobin, which the test finds the average level of your blood glucose over 3 months. It tries to find the average level of your blood glucose, the fluctuations, the stability, the variations in your blood sugar level amidst the treatment you're taking. So once you do that glycated hemoglobin, which is called hemoglobin A1C, and you have a value below 5.7%, that is a good one. So, but when you are having a value above 6.5%, it's telling you that amidst the treatment, your sugar is still very, very, very much uncontrolled. So, hemoglobin A1C is very, very important. I think in that manual, it was also mentioned that as part of the follow-up, we should recommend glycated hemoglobin or hemoglobin A1C for our client or patient that we are treating with a Superlife product. So I don't want to take much of our time. Superlife product, as Dr. Rose have said, ST30, SIC, they are very good at dealing with diabetes. The major mechanism is that they prevent destruction or what we call autoimmune destruction of islets of Langerhans cells or beta cells in the pancreas. They prevent the destruction. So apart from preventing destruction, they help to rebuild by stem cell therapy the one that have been destroyed. And another mechanism of action, they prevent insulin resistance. Insulin resistance, or what we call hyperinsulinemia, is one of the major causes of diabetes type 2. which he mentioned that is non-insulin dependent. Diabetes type 2, the major preponderance of causative effect is insulin resistance. And so Superlife products help to prevent insulin resistance. What is insulin resistance? Your cells are not able to utilize or respond to insulin usage. So because of that, your glucose level will be accumulating. Insulin that is produced is not being used. The insulin cannot mobilize the glucose back into the muscle cells, cannot mobilize them into the adipose tissues, cannot mobilize them into the liver. So Superlife product prevents that insulin resistance, and Superlife product also prevents impaired glucose tolerance. So impaired glucose tolerance. So when you have impaired glucose tolerance, it will predispose you to be having higher blood sugar level to the state of diabetes. So Superlife product also prevent impaired glucose tolerance. So those are the molecular mechanisms of action with which it's able to deal with. Of course, you know that it helps in mobilizing your immune system to help a quick healing of wounds, because when diabetic people, when they have wounds, slow healing. So Superlife helps in increasing what we call the antiseptic property of the immune system, so that it will increase it will fasten wound healing. So that is this. So I just want us to know that. Let us have time to go through this manual from page to page and grasp what we need to grasp. So thank you very much. So I don't waste your time so that you can entertain questions from people. Thank you.
Thank you, Dr. Chooks. And thank you once more, Dr. Rose. God will surely reward you guys, and we too. Thank you, thank you.
Please, can you speak up? I can barely hear you from here.
Okay. Thank you very much. The doctors in the house. God bless you all. Now, before we go into the questions, we want to use this junction to let us know we are really, really focusing on the health. Remember, we have two parts. The super health is part 1, which is the major part. Then plus super wealth, which goes to Superlife. But when it comes to this health, we want to give it to its health, because that is the main major thing. So, having heard about this now, we are going to have this content directed to our YouTube page. For those of us that came earlier enough, the early birds, I mentioned, you have mentioned how you can search it out. But for those that came late, let me repeat it, that if you go to Superlife Lagos Nigeria in YouTube, just go there, type Superlife Lagos Nigeria. It's going to pump up, so that some of those content that we already have there, like the September 7 event, and then we are going to start uploading the content with the series that we are already having with Dr. Rose, starting with malaria, mosquito and malaria, of course. But then after which the infertility that we treated last week, and today's one, which is diabetes. All these things will be directing them to that content. If you type Superlife Lagos Nigeria, if you couldn't get it, just type again, Superlife Revolution Movement. That's the second part of it. Any of the two will land you to the page. Then, having said this, our Superlife product, thank God, inspired by nature and realized by science. And that is where the end of the discussion. That for one sachet of this covers a lot of herbal concoction, whether abo or what have you, if you can. We were privileged to be in Malaysia, in Switzerland, to see where they are culturing this thing, just like a fingering, those that are breeding fish, those fingering. And that thing will be there for minimum of 3 years for maturity. I'm talking about plant-based, plant stem cells. The biochemistry is really doing a lot. So but thank God that we are seeing it in a simple form. Where a lot have gone in, 1,500 milligrams for one sachet. And like we normally say that one sachet a day keeps you away from hospital. So please, if you are coming to use any of our products for your health or for the health of your loved ones, please make sure that you connect to our company. Connect to our company as a customer. Be a customer to our company. Don't patronize people, somebody that will be buying and be adding profit and be reselling it to you. If the person is not ready to connect you to the company, I know that suspect that there's something there. What it just requires for you to connect to our company is your valid means of identification. Our company recognizes government ID card. If you have NIN, is good. If you have voter's card, is very good. If you have driver's license, very, very good. Or international passport, any one of them is good to go. Even if you are somebody that you want to, maybe you don't have it and you needed it, and any of your relation has it, you can use that person's details to come and get our products. Getting it directly will save you a whole lot. The next thing after valid ID card is your valid email address. These are the two main things that is needed for you to connect to our company. Once you are connected, it guarantees that you are getting a genuine product. I don't need to begin to emphasize that a lot of fake products are out there, more especially in so many pharmaceutical stores. Before now, I normally say that if you see our product in any pharmaceutical stores, they are fake. But since after the events of last month, good number of pharmaceutical stores have started identifying with us. Very soon, we are going to begin to mention their names and the addresses, so that's where you can go and get our genuine products. Outside those ones, any other one, what you are seeing there is fake. Then our product, STC30, quite sure this picture you are seeing now is still our old picture, the old pack of STC30. Our new STC30 has additional ingredients, and the pack now comes with NAFDAC number on the pack, on top on the pack, and the QR code. SIC, Superlife Immune Care 2. The recent pack that we are distributing now comes with NAFDAC number and QR code. In a very short while, the remaining three products, all of them are already having their NAFDAC number, but not yet the number on the pack. But very soon now, all of them will be. So please connect to the company, and you will be as a customer, get registered, and you receive email directly from Superlife World, congratulating you, giving you your username and your default password, so that you can use it to navigate. The subsequent repurchase, you'll be repurchasing directly at the company's discounted price. They are after our well-being, and they wouldn't want you for anything to shortchange yourself or your health. Many people who have used fake products of so-called Superlife, many of them have landed themselves in a more serious matter. So please, if it is not genuine products, don't patronize it. You can better go for the herbal than buying fake products, even if it is free. How much more you pay in any amount? So having said that, I think we are going to take the questions. And please, for those of us who will want our complete compensation plan, we are going to make out another day. We are going to announce it so that we will now dissect the full comp plan. This is a comp plan, a company that pays over 90% of their product of their profits to their distributors. I repeat, Superlife pay their payout over 90% of their profits to their distributors. And we that are already active members can attest to that. By the special grace of God, I'm up almost 6 years in this industry. I can attest to that, and many others. And thank God for so many things that have come to be now. Just like NAFDAC certifying our product March this year, it was a new dawn to every one of us here in Nigeria. And that's why you are seeing wonderful things coming up. People are now understanding it better, not falling a victim of those ingullible ones that are selling fake products. So please, thank you, even as we are going to take those questions. I guess Samson, you are around, you are in the house, Abi? Coach Samson.
I'm here.
Please quickly check the chat room. And
I didn't see any question, no.
Okay, there's no question. Okay, that's a good one. That's to show that Dr. Egbe really did enough justice in a layman language, even though it's
there are many questions. There are many questions.
Huh?
There are many questions.
There are many questions on the screen.
Samson,
there are questions there. Samson, check and where there are questions.
Samson is.
You check and where.
Me, I can't see anyone in the chat too.
Samson, now what for you? There are questions.
In the chat, I can't see.
Wait, hold on, please.
We have glasses now.
Please, hold on. Please.
Go get your glasses.
I'm on it now.
Which glasses? It's not open here in my chat.
Please, Samson, it's okay.
It's not open. There's another question here. Let me read this one for you.
Multiple grace. Hold on, please. Let me take it from this end. Hold on. This is from Edward Chibuzo, Ezekiel. He said, what often attack the cells that regenerate insulin in MINT part 1? What often attack the cells that regenerate insulin in MINT part 1? I don't know whether doctor in the house, Dr. Egbe, you understand what the question is, what he's trying to ask.
You made us understand that the cells that produce this insulin will be attacked. That's part 1. So attacks the cells.
Hold on. Is the person that asked question that maybe is like trying to throw more light?
Yes.
Can you speak out, Edward Chibuzo? Is your question?
Okay. When he was lecturing us, he made us to understand that the productive cells normally attacked that make it unable to produce the insulin that causes So my question is what really attacks the cells that make it unable to produce the insulin?
Okay. Can I go ahead and answer the question now?
Go ahead, sir.
I want to thank you for that question. Secondly, I'm happy that the Choose to is around. So we'll be doing the answers section together. Mr. Samson, you're coming in late. Mr. Samson too will be joining in answering. So that we all have a robust answers today. Now, there's what we call autoimmunity. Now, in the course of my lecture, I said for those who study immunology, for those of us, the medical personnel, they are quite conversant with that word. We refer to it as the negative side of immunity. Your body we have natural immunity. Our body has natural immunity. Our body equally has innate immunity. There are two types. That is why I don't want to go into details. So when you now find your body fighting itself, sometimes it becomes pathetic, where cells of your body begins to attack other cells. So we see it in occurring, and that is why it is called autoimmunity, where cells are attacked by other cells. And when you now have these cells that are meant to produce or regenerate the cells that will help produce insulin, then you now have the kind of condition that we discussed earlier. So in immunology, it is not a strange thing, but to those who are not conversant with the field, they'll begin to wonder what is really causing it. And that is why when Dr. Chus was answering,